Now let's bring our focus to something that is rare, and I'm talking about rare diseases, and this will be marked, the Rare Disease Day will be marked on the 28th of this month worldwide, but in Kenya it will be marked on the 24th of this month. Now the question here is, do you know what rare diseases are? Well, I'm also getting to learn about the same, and to help us walk this talk is actually Dr. Laura Musambai, who is the founder of Multiple Sclerosis Kenya, and she's also a person living with a rare disease. Thank you for joining us.
Thank you.
And we are also joined by Alice Kamania, who is a nurse and part of Rare Disease Kenya, and also a mother to a child living with a rare disease. Thank you for joining us. All right, Dr. I'll start with you. You were diagnosed at 15 years with a rare disease. Give us in a nutshell your journey.
So I was 14 actually, going on 15, and one day I woke up and I couldn't walk, and I was taken to hospital, and after a battery of tests they told me, well, we don't know what the reason is behind your paralysis, but we'll keep investigating. 6 months later I was able to get back on my feet. I had to transfer from a boarding school to a day school, and I actually didn't have any other incidents after that, but 2 years after my first episode, I got paralyzed again. And in the interim between then, I'd been discussing with my doctor and telling him I've been reading up and it looks like I have this condition. And my doctor said, yeah, well, it doesn't really happen in the tropics much, and you're a female, it doesn't affect females much, and you're very young. And while we're having that conversation, the following day, I had a repeat episode. And so it's been a journey of good days and bad days, and learning how to live with it, getting treatment modalities as much as they are available, and basically trying to make the best of every day.
Okay.
So I started the Multiple Sclerosis Association of Kenya. At the time when I started it, I was in 4th year of medical school, and it was mostly a support group for people who live with the condition, because I had had such a horrible time when I didn't know what it was, and when I knew what it was, I didn't know what to do with it. I didn't want anyone else to ever go through that again. But it's now a society registered.
Okay. Alice, for you, the story is a little bit different. It has to do with your child, your second born, Eliana, and as we speak, she's actually at the Kenyatta National Hospital. Give us a little bit detail on her journey.
Okay, Eliana is my second born child. She was born on 2014, September. And we woke up like any other normal day. We were prepared to receive our second born, and I was to undergo an elective cesarean section. And we went, I was excited, expecting a child, but after theater, as expected, I was expecting to get my child on my bed, or somewhere near my bed, but that didn't happen. Once I was taken back to the ward, I couldn't find my child. So I made an inquiry, where is the child? Is there a problem? And the response I received was that the child is having some issues with breathing. She was put on oxygen. And after some, like 2 hours, the child was brought to me. I tried to breastfeed the child couldn't breastfeed. I tried to, even the cry that she was making, it was very short cries, that seemed somehow to me, it seemed like it's not normal. So I decided let me expose the child and maybe examine her. What's the problem? That's why I noticed that she was breathing with pauses. And I alerted the nurses who are on duty, please come and check on the child. I feel like there is a problem. And they called the doctor who was on call. He came and examined the child. And the information he gave me was, the child looks very sick. We are going to send you to a hospital where we can get ICU care. She was born in Magadi. We have a hospital in Magadi, and we came looking for a hospital. We went for like 3 hospitals, but we couldn't be admitted because of they needed like a deposit, which was too high on some of the hospitals. And we landed at Gertrude's, where we were admitted. We thought probably it's something that's going to take a short time, but it never happened to be so. We went for months, many months. We were in Gertrude's for 7 months. being managed for breathing issues. What she used to do, she was breathing, yes, but it was not adequate. So once she's taken out of the mechanical ventilator support, she used to retain carbon dioxide, then she goes into a comatose. She becomes comatose, she's taken back to the ventilator. So we used to get discharged from the ICU to the ward, back to ICU. So that was the journey until 1 month of age, where Eliana was, she couldn't come out of ICU. And
At 1 year?
At 1 month, 4 weeks of age. And Dr. told me, now what we need to do, we'll put a tube at this tracheostomy tube, which is going to be used to ventilate her through the mechanical ventilator. So we thought probably it's a journey that's going to take maybe it's 1 month more. But that never happened. After 7 months of stay at Gertrude's, we couldn't sustain her at Gertrude's because it was very expensive. And that's where we sought to transfer Eliana from Gertrude's to Kenyatta National Hospital. And that was done in April 2015. And Eliana, up to date, is still in Kenyatta. She has been in ICU all through. By April this year, we will be 3 years in Kenyatta. She's still under mechanical ventilator support, and she's a very delicate child.
Let me ask you at this point, Alice, have you ever been able to hold your child?
Body.
Have you ever held her in your arms?
Yes. Not from the time she was small. I started holding her. I couldn't breastfeed her, yes, because she had difficulties in feeding. But up to date, when I go to Kenyatta, I usually hold her. She's conscious, fully conscious and fully alert, and very playful for that matter. So we will play, hold her, we do some. Well, she has delayed milestones, but at least I can hold her, she can sit. Yeah.
Okay. Now, Dr. Laura, I mean, there's 7,000 plus approximately number of rare diseases in the world. And one that Alice and Eliana have to deal with is called CCHS, which is what exactly?
CCHS is congenital central hypoventilation syndrome.
Okay. Which is one of the many diseases we're speaking of. So, Dr. when it comes to the tropics, what are some of those diseases that are probably common in the tropics than they are in other areas?
So to refer to them as common in the tropics is sort of going against what rare diseases is about. I guess, if you allow me to correct that, it is a rare disease, but it is rarer in some areas than in others. Within the tropics, some of the diseases that we see, including CHHS, include trisomies. Trisomies are diseases where when the baby is forming, when a fetus is forming in the womb, there are these chromosomes that are supposed to split in a particular way or join in a particular way, and sometimes they don't. Instead of ending up with 2, you have 3 attached to each other. And so depending on which chromosome is affected, the baby or the adult will manifest with illnesses around that area. Some other diseases include Joubert syndrome, multiple sclerosis. Even though multiple sclerosis Kenya is part of rare diseases Kenya right now, it's not as rare as the other diseases that are seen within the tropics. And multiple sclerosis has other diseases that look like it: neuromyelitis optica, Devick's disease, transverse myelitis. Essentially, because of the sheer number of them, and because of very little research that has been conducted around them, it's difficult for me to say with expertise that these are the ones that we've seen within the tropics and they're the only ones, but there's research going on around them. And what we usually advise as doctors, and even amongst ourselves, what we advise is, if you see a child who is presenting with an illness that is affecting more than one system, beyond the primary care that you give this child, have that investigated. We tend to lump it up in one, this child has a neurological condition, but what is it? It probably has a name. Research probably has been done around it, but look at it, and if you cannot do it, then refer the child to someone who can investigate and see what illness is this child has that is presenting with these particular systemic issues. Yes.
All right, Alice, 50% of the rare diseases affect children. My question is, what did the doctors allude to Eliana's condition?
Okay, basically, I would say from the time Eliana was admitted, it has been difficult to find a doctor who is conversant in managing CCHS. Basically, the doctors who are in Eliana's case, none of them has had a previous experience in managing a CCHS patient. Yeah.
Okay, and what did the doctors say? How did this come around? It's genetically?
Yeah, it is a genetic condition,
yes,
that affects the nervous system. And basically what happens, this kind of patients, they lack the involuntary control of breathing, and they cannot control their breathing involuntarily, so they need support from the mechanical ventilator. And basically, if you do not support these patients using a mechanical ventilator, they tend to get an imbalance between the carbon dioxide and oxygen. Basically, like Eliana, she tends to retain carbon dioxide, especially when she's asleep, when she's sick, or when she's stressed.
Okay.
Yeah.
All right, Dr. Ari, they say accurate diagnosis often happens between 10 to 15 years, but you're saying the earlier, the better. So in the case of Alice, she probably is luckier because it can be managed. But what are some of the loopholes probably when it comes to managing rare diseases?
So by virtue of them being rare, and I'm saying this both as a doctor and as a patient of a chronic illness, by virtue of them being rare, we are not exposed to them as doctors. I'll give you an example. I trained, part of my training was at University of Nairobi through Kenyatta Hospital. And if I have never seen a child with CHHS, when I go to practice, it is hard for me to call this CHHS because I don't know it. So that's one loophole. It has not been emphasized in the training in medical school, whatever that is. And it's understandable because there's 7,000 of them. And then there are illnesses that we actually need to know. The commonly occurring ones, malaria, diabetes, hypertension, pneumonias. So that's one loophole. The second loophole would be we don't have very good diagnostic equipment. For patients with MS, because it's a neurological illness, you usually need very expensive tests, including MRI scans and maybe some blood tests. My blood test had to be sent to South Africa. When I was diagnosed, I could only afford one MRI a year, and I was in Nairobi. There are patients who might have MS, who might have CHHS, who are in far-flung areas of the country. If that doctor there knows what this might be, has an idea, but they cannot test it adequately, they cannot diagnose it. The third loophole, which is a really big deal right now in the country, is research. If we don't conduct research, we cannot emphasize it enough. We don't know how much to emphasize it because we don't know what is the magnitude of the problem. And most universities now, medical schools, in conjunction with Ministry of Health, are trying to emphasize that. Try and say how many patients have this particular illness that we are thinking it's rare. We might find it's not rare. We're just treating maybe malaria, and this is something that we need to get off the table and focus on other things. Which parts of the country are affected? Why is it that people from that part of the country are affected? Is there something environmental? Is it something about the genetics of the people in that area? So research is a big deal, and even after you have filled these three loopholes, we still have to bring it to the patient's level and ask, so what? So Laura has MS, so what? What are you doing about it? Treatment modalities and interventions are very limited, especially because they're genetic. As a country, we haven't really yet gotten to the part where we have genetic interventions for treatment, even in the world, but that's not to say that it's not worth pursuing.
Okay. Now, Alice, the other challenge I'm sure for you is the finances. Your child has been in ICU since birth. please give us a detail, probably a few in a nutshell, of how you've been dealing with the finances of it.
Okay, financial costing for maintaining a child or a patient in ICU is a very big challenge, and especially for us, Eliana having been admitted on the first day of life in ICU. I've mentioned before that we had to transfer Eliana from Gertrude's. It's not that the care at Gertrude's was not good, but because we couldn't sustain the costing. And even after coming to Kenyatta, maintaining a child in ICU under a mechanical ventilator is still also a challenge, because it's a public hospital, yes, but it's not free. It's not free because it's ICU, it's not like a general ward. It's different in terms of costing. And as at now, Eliana's bill is very high. It's huge. It's in terms of millions, over 10 million. In fact, it reached a point we couldn't even go to check on the bills because it was alarming, and we are finding it challenging. We are like, even if we get the bill is 20 million and the child is still in the hospital, what much can I do? For la common mwananchi, it is difficult to sustain a patient with CCHS or any other condition requiring mechanical ventilator. And even bringing such a child at home, we do have some of the members of the rare conditions who are nursing their children at home at a mechanical ventilator. And maintaining a child at home at a mechanical ventilator is very expensive, it's very costly. It is the best, yes, but it calls for finances.
Okay.
Wow.
Now, Dr. the finances of it, I mean, the list goes on and on. What are some of the strides probably we have made, or what are the things that you would like stakeholders to step in and help out with, especially starting off with the finances of it?
Yeah, to begin with, because I am a healthcare manager, I'm doing an MBA in healthcare management, so it's something that is right at the heart of my passion. We need a functional health system. Gladys, if we have a health system that allows someone with a rare disease to live a dignified life, then we don't need to spend a lot more money on fighting each illness. I say this with the understanding that we are burdened by a double burden of disease. We are still fighting infectious disease. We are now starting to deal with non-communicable diseases. And here Laura and Alice saying, oh, look at MS and look at CHHS and trisomies and other illnesses. But how about we make sure that if a patient has any illness whatsoever, they can get basic primary health care. And if they need advanced care, for example, children like Eliana, then we can focus on getting that on AVENT and home care services. Why don't we make sure that we have such functional hospitals all over the country so that patients like Eliana or Laura who are in Marsabit don't have to come to Nairobi. That's a place where stakeholders can get involved. NHIF can help patients with chronic illnesses and with rare diseases, because some of the treatment modalities that we need are not those expensive disease-modifying drugs. Like I mentioned, it might be a genetic illness. What are we going to do about that right now? But what you can do is, if she's in pain, can she access pain medication? If she has stiffness, can she access that? Is physiotherapy readily available? Can she see a GP for a common illness like a urinary tract infection easily? If we do that, then it makes it easier to help the people with the systems that are already there, and then focus on extra funds being directed to those with rare illnesses. And one more thing I'd like to emphasize is mental health. We tend to forget the mental health of people with such illnesses, both them and their caregivers. It's very taxing. When I listen to Alice speaking, sometimes I want to cry. She is constantly, fighting something mentally. She has another child. She has other responsibilities. Can we help them galvanize their mental health? Can we emphasize it so that even as we are taking care of their physical illness that we can see, we help them cope with the emotional stresses of the illness that they're dealing with.
Okay, and Alice, speaking of which, you are a nurse, you're a mother, you have another child to take care of. How do you balance it all out?
It's very challenging to say, because I've forgotten to mention I'm married. So I'm married, another child at home, another one in hospital. And before Eliana was born, I was not staying in Nairobi. I was just a visitor once in a while. And having Eliana being managed in Nairobi have totally destabilized myself and my family. Because our firstborn is in class 1, and by then she was in baby class. Now we are admitted in Gertrude's, 8 months, 1 year, 2 years in hospital. We have to be in Nairobi once in a while, if not continuously. Then the other one is in baby class. She's also small. Then the dad is here, the wife. Is balancing basically has called a lot of sacrifice. We sacrifice a lot because you have to miss some. You have to miss some of the things that you feel. For now, they are not priorities. My priorities as at now is my child, who is Eliana, and the other one. So basically, I keep traveling because she is in Kajiado West. The first one is in Kajiado West, where she schools, and Eliana is in Nairobi. So I keep traveling a lot. Once in a while, I'm in Kajiado West. Other times, I'm in Nairobi with Eliana, and the dad had to come to Nairobi because of Eliana. So he had to change whatever he was doing. So it has called a lot of sacrifice to support the 2 children and the family generally. Yeah.
And definitely a good support system goes a long way. Speaking of which, for those that have to be caregivers to children living with rare diseases or just, family members of the same, what would you say to stakeholders, the employers, those are in medicine and what have you? What should they consider while dealing with such people?
Me?
Doctor.
A little kindness goes a long way. Allow me to give by way of example. My employers are very kind. There are days when I cannot get out of bed. I know I look like I'm very okay right now, but there are days, it might even be this afternoon, I might not be able to go back to work. But beyond allowing me to work, my employers have allowed me to have a flexi schedule, which is a lot to ask from a doctor, but they have allowed me to have a flexi schedule. My colleagues are willing to step in, so most times I'll have someone backing me up on the rota. And when I am well, then I do my share of the work. I would encourage family members and friends of people who have rare diseases or any other illness. Random acts of kindness make a difference. Sometimes my friends would step in to do my laundry or to do my dishes, and it looks like it's a small thing, but if you consider that I was probably not going to eat today because I don't have the energy to stand by the fireplace, then it's a big deal. You fed me, literally. And we have support groups for patients who live with these illnesses. The members of those support groups sometimes also live with those illnesses. Most times, I am the vice chair of MS Kenya, and I have MS. So if it were not for the support that I receive from my friends, my family, my employer, I would not be able to help other people who have the same illness. And employers sometimes, and I understand that sometimes it's a business and you're all about making profit and making money, but we have members who end up being fired or who end up being summarily dismissed because they're not able to do that work. And it's a bit unfair. Our laws are still evolving to allow persons with unrecognized disabilities to be accommodated. But while we are waiting to get there, why don't we be human and just do it?
Okay, so the World Rare Disease Day will be marked on the 28th of this month, but in Kenya, this will be marked on the 24th of this month. There are some objectives going towards this day, and Laura and Alice will be filling us in on the same right after this break. Stay with us. And rare diseases is something that most people have no idea about, but the statistics show there are over 7,000 rare diseases in the world, and 300 million plus people are actually living with rare diseases, and most of those are actually in this country. Now, to walk us through this journey of rare diseases, with me in studio is Dr. Laura Musambai. She is a founder of Multiple Sclerosis Kenya, and we are also joined by Alice Kamania. She's a nurse and a caregiver to a child living with a rare disease, and she's from Rare Disease Kenya. Well, ladies, the day is coming closer and closer. What are some of the objectives or some of the things you'd like to accomplish come this time around?
We would like to, first of all, create awareness. Create awareness to Kenyans, create awareness to doctors, create awareness among stakeholders that these illnesses exist, and don't forget them. Because when someone has a rare disease, by whatever name it calls themselves, even if the statistics say 1% of people have this disease, when I have that disease, I have it 100%. I don't get to have it 1%. And I need to be able to live life just as much as I can, but I need help. So we are creating awareness around rare diseases. We also would like to emphasize research. The worldwide theme for World Rare Disease Day this year is research. We want stakeholders, Ministry of Health, medical schools, scientists, Welcome Trust, to get together and conduct research around these illnesses. It might not lead to us getting a cure. We pray that it does. We hope that we will continue being the trailblazing country we have been in the last 6 months, positively this time, and create a cure for some of these illnesses. But meanwhile, can we just get to know these illnesses in depth? And from there, then we can inform policies, even at Ministry of Health level. Now that we know this is this illness, and this is how it manifests, and this is where it is to be found, and these are the people who are affected, we can direct resources in a more effective manner.
Okay. For you, Alice, this day I'm sure means a lot to you because you have a child that you're also learning to give care to. What, maybe the question to you would be, some of the issues or myths that came out from, you know, friends, family, as to why you ended up with a child like this? Because I know myths are a biggest obstacle in dealing with rare diseases.
Okay, basically, when Eliana was diagnosed with congenital central hypoventilation syndrome, we got a lot of information from friends, from family. Some of them were positive, some of them were heartbreaking. Because having never seen such cases probably in the past, people would come telling us, oh, could be this is witchcraft, could be it's a curse, could be you did something, probably you are paying. So, and the doctors were like, in fact, some of the medical people, because they didn't have exposure, past exposure of such thing, such a condition, they could tell us, oh, have you got to pay dowry? Are there family issues? We thought probably it's not a disease, but it turned with a lot of, we have done a lot of to connecting with people in social media, whereby we met with people who have such issues, and that's where we came to know, oh, it's a disease. It's common in other places, but in our country, it's a rare one. Yeah. Okay,
Dr. with that kind of thinking, myths and what have you, it could be also one of the reasons where some people don't even come out to seek help.
It's true, it's true. And I was actually also told I was bewitched because I had performed really well and I had gone to a national school, so it's possible someone did not want me to do well in life. And you know, at the time when you're getting this kind of diagnosis, you're very vulnerable. So you take time to check who in your family does not like how you dress or who does not like how you talk to them, and in the meantime you're finding out what's all this witchcraft thing about. You're taking time to get treatment. And the other thing that for me was an issue is my family had a problem accepting the diagnosis, and so we would make advances towards acceptance, because every time you have such an illness you have to grieve it. You have to grieve it, go through the stages of grief, and you are heading towards acceptance. And someone says, so I know this pastor somewhere who washes feet or whatever, and so my family carries me and we go. I was in a wheelchair at the time, and we go and my feet are washed, and I don't know, a cloth is laid on me and oil is poured and food is changed, and they are hanging on to hope that one of these things is going to work. And in that period of time, I'm not saying a doctor, because we are waiting for healing to happen. I'm a Christian, and I'm a doctor, and I'm the first person to admit that yes, miracles happen, and sometimes some of these illnesses go away. But is it possible for us to go and have our feet washed while we see a doctor at the same time? And can we have oil poured on us while we see a doctor, so that while maybe the healing might come from medicine, you know? And so the whole process really delays treatment.
Okay, all right. And when we talk about support systems, some accept, some walk with you, do not accept. So for those that walk with you, and especially outside that circle of family, are those that actually understand because they have children or family members that are living with rare diseases. How can somebody reach out to such so that they also are, you know, given a chance at a quality life? Alice?
Okay. In Kenya, we had to form an umbrella body called Rare Disease Kenya, and this umbrella is mainly it's for the patients and parents of children who are affected by the rare disease. And in attempt to reach to many people, we have a group, or we do have accounts in Facebook. It's called Rare Disease Kenya. We also have an account with Twitter called Rare Disease Kenya. We have an email, info@rarediseasekenya.com. All those are platforms. We are trying to reach out to people. If you have come across a patient or a family who is struggling with a rare condition, you can contact the Rare Disease group, and then we can come over. Basically, it's emotional support. When you will find people who are going through common problems, and at a point you feel relieved. At a point you feel more comforted. Yeah.
Okay. Now, Dr. You have a support group. Some people are reaching out to you. They want to help you, but there's some people who are just adamant they do not want the help. Have you come across such?
Oh yes, yes. I used to be one of them. So having a chronic illness of any kind, Gladys, is difficult because it changes fundamentally who you are, who you perceive yourself. And you can put up a face for everybody else, but you cannot put up a face for yourself because you live with you and you know your weaknesses. Maybe because of how we as doctors, and I apologize to Kenyans worldwide on behalf of some of us who might not have been very sensitive when delivering such news, will tell you, Gladys, you have CHHS, and then we walk away. And we don't walk the journey with you, or we don't give you information. So the first thing you do as a human being is you panic, because what is CHHS? How do I move from here? And it's something that happens because of reason A, B through Z, that patients are not very equipped. And so that would affect them seeking help. Because first of all, they become vulnerable to the things we just talked about. Go to this pastor, go to that witchcraft, take this medication, do that. And also because no one took the time to explain to you what the illness is, no one is helping you grieve. If I told you right now, we've got to cut your leg, you didn't think that you wouldn't make it to 2019 without your leg. So someone has to help you grieve the loss of that leg before, during, and after the leg is gone, because you have to rearrange your life around not having one leg. And that's the same thing with people with chronic illnesses. And because we don't walk that journey with them, and so they try as much as possible, I tried as much as possible to persuade myself that things are not different. I was in a wheelchair and I was back in school and I was performing, and you know, sometimes I would be acutely aware of it, but the times I'd throw it away and be like, we are going to do this. And I have learned to understand, before I would force that help down their throats. You have a mess, we are going to get you better because you can be better. But wisdom comes with years sometimes and with experience, and I have learned that help them in another way, help them how they want to be helped right now, and let them come to you sometimes if they want a different kind of help. Don't shove it down their throat. It's aggressive, it's arrogant. And we, in our support group, have really tried to emphasize counseling, because it's one way to help someone accept the condition. But also with our patients, we try to emphasize to them, when help is given, accept it, because sometimes you need it, and it's to make your life easy. It does not diminish you as a person. It does not mean you've stopped being a human being that is worthy. It just means that in this particular instant, you're not performing as best as you can, and it might help your life a little better if someone helps you in this one thing that you need.
Okay, Alice, some other statistics is that 30% of children with rare diseases might not be able to see their 5th birthday. You have a child who's 3 years plus. What are some of the things you would want done to help you ensure that your child lives through the 5-year mark?
Okay, I would say it's frustrating to hear that is the status, that most of these children will not live to see their 5th birthday. But we believe with good support, these kids, depending on the diagnosis and the condition that they're battling, we have met through the social media connections, we have met people who, especially with CCHS, have been able to see a mechanical ventilator, especially at night, but they are living better. So I believe with the good support, with good management, especially from the people we are close to, like the family and the doctors, I believe Eliana can live longer, and she's going to live longer, because at least we have gotten information early enough, and we are still trying to connect with more people who have dealt with CCHS in the past, internationally. And we trust God that Eliana is going to live. She will come out of that hospital. And we decided, myself and the dad, that we have to work as a team. And this is a team of 2 people, because they are the parents to this child. And even if we miss to get probably a 3rd person, we believe that we are going to support Eliana the much we can to see Eliana live to the maximum. Yeah.
And speaking of living to the maximum, I mean, Laura, you were diagnosed at 14 years. Here you are, and an accomplished doctor. I mean, there is hope.
There really is. Gladys, I have learned that you never know what you're capable of until life demands it of you. If you had caught me when I was 13 and told me that I would be here, I'd probably, I'd have just shrugged. But because of what I have been through, I have been able to help other people with the same condition. I still have some downtime, some bad days, but what I tell myself is, what is the converse? Do I sit down and cry, and then what? And that is the same message that we would like to spread to other people living with chronic illnesses. One, you're not alone. You're not alone. It might look like you are, but you aren't. And we are doing research around it to prove to you that you're not alone. But also, Eliana has CHHS. I have MS. I don't have to have CHHS to offer her support. So other people who might have these illnesses, you don't have to have my exact illness for me to offer you support. But just in talking to Alice, and she tells me, so these are my struggles, and I tell her these are my struggles, and we exchange stories, it gives you some strength to go on. And within the MS group that I run, I feel MS has been very kind to me. To put it mildly, I don't celebrate it, but I feel it's been mild. There are people who are worse off. And there are days when I feel like I'm spoiled, just seeing someone able to go to work, able to go up the stairs. I use a cane. Sometimes I'm stubborn with it, but there's someone somewhere who's wheelchair bound, who is in a walker, who can't do the things I do, and it gives me hope. So being around such people gives you hope. But the one thing, Gladys, I cannot do, nobody can do, is to give you the willingness to live. That you have to find from somewhere inside of you. And that's one of the things the support group tries to encourage in people. We can do this much, but ultimately you have to want to fight to live.
Sure. All right. And speaking of which, Alice, you talked about the support system you have. You and your husband are the team that make Eliana, you know, go on every single day. But you also have another child to think about. So how have you been able to explain to this other child what's going on with his sibling?
Okay, basically, when Eliana was born, our other child was still very young. She was 3 years, and initially she couldn't understand, why are my parents away all of a sudden? They have disappeared, they're in Nairobi. But she had come to see Eliana when she was born in Magadi. She came, and the following day she's getting information, oh, they went to Nairobi at night, and we had to bring her. We requested the administration at Gertrude's, please, could you allow, she's Olivia, could you please allow her sister, Eliana's sister, to see her? And they accepted. And even in Kenyatta, she usually comes. But it's not that it is that easy as at now. Even as at now, she's like, Mommy, can I come with a gun and shoot those doctors? Why are they still retaining my sister? Can't they see that I'm getting bored?
The innocence of a child.
Can't they see that I don't have a playmate? Then I usually prepare her in advance. Mommy, you know what? I'll be traveling on this and that day to go and check on your sister. And she's like, hi, Mommy, you're always going to Nairobi. Why can't you allow Daddy to be checking on Eliana and then you stay with me? Then I have to explain. I'm like, I'm coming back and I'll come back with Dad so that we can also check on you, both of us, because Eliana needs both of us, and you also need both of us. So she has come to accept. And I usually leave her with some of my friends. I've gotten friends who have been supportive, my colleagues at work, and even our employer in Magadi. They usually release us, and then at times when I'm in Nairobi, I can send somebody, please go and check on her. Is she okay? Then through support from friends, from the employer, we have been able to manage and also make her understand that Eliana will one day come home.
Okay.
So,
all right.
Yeah.
Now, Daktari, I hear a lot of emotional engagement in this journey. And as a founder of Multiple Sclerosis Kenya and in extension part of the Rare Disease Kenya, what are some of those support systems you've gone to probably give to the counties? Because I'm thinking somebody's listening to you and wondering, I've got all this going on. You talked about the mental state of that caregiver. How do you help these people?
You're asking how I help who? Sorry?
How have you been able to form systems that help those that are out there in the mashinani, in the counties, to actually get the support that they need? Okay,
so because most of the diagnostics and treatment and the neurologists who handle patients with MS are in Nairobi, most of my patients are focused in Nairobi. However, we have 2 members in Eldoret, 3 in Kisumu, and a couple in Mombasa. So what I would usually end up doing is travel there. We'll find one official or one person who has the illness to travel there and meet them and talk to them and try and see whether we can help them build capacity to help each others. So for as much as MS Kenya is centered in Nairobi, we help those people in the mashinanis as close as possible to meet each other, and then we support them from a distance. Mostly because we are self-funded. So any money that we get is self-funded or from friends of friends of friends of family, and we are not able to establish satellite meetings in those areas. We have one meeting a year, the World MS Day, which is usually in May, and so we try as much as possible to bring all of them to come here. But thank God for technology, because even if I'm not able to go there, I make it a habit to go there because it's easier for me to relate with Gladys if she has seen me. I have a personality that is different on social media, and it's difficult to relate to that person maybe because you've not met them. And because I look fairly normal, when I'm sitting here, you don't know that I have MS until when I start walking. It's easier when this person sees me. So that's a personal habit. But because of technology, we keep in touch with them on phone. We try and make sure when I get a patient or someone who has a patient who has MS, what I do is I call them. Do you have, first thing, don't panic. 2, do you have a neuro? Do you have a proper caregiver? What are the things that are bothering you right now that we can help as MS Kenya? Who can we put you in touch with? And thank God we have some doctors, some healthcare practitioners who partner with MS Kenya to help these patients. And we try and see whether they can talk to them on phone or actually go and visit them and take care of them. And we try and also ask this person, what is the support system around your family? Because sometimes you find that the family neglects them and they have to deal with this illness by themselves. So how can we try and strengthen that support system around you while we wait to get you a counselor, a neurologist, a psychotherapist, and what other illnesses, what other specialists that you need to live with this illness?
Okay, for you, Alice, you had to leave Magadi, come to Nairobi to make sure that your child gets the care they need. But there are so many other people out there who do not have probably what you have, and they have to make do with wherever they are and what they have. So what is Rare Disease Kenya doing to help them live a quality life and also get to get some of this help from those that are walking the talk?
Okay, Rare Disease Kenya is trying to reach out to people with rare diseases. Some of them are not able, some of them are passing through difficult times, but once they reach out to us as Rare Disease Kenya, the team normally makes attempts, even visiting physically, and they come, you share. When you share, you feel, you get a relief. Basically, in Rare Disease Kenya, we help wherever we can. If there is any contribution in terms of medical care, we do, like suggesting the doctors. Some of us have come across many doctors when our kids are being managed, and we usually try to connect with those people. Probably they're at home. We visit them, they share, and you make your contributions, trying to improve the quality of life of these people. Yeah.
Okay, for you, Daktari, I mean, thinking about the journey that you have made, you were once a young person, you have grown to your own and you understand what you have to deal with. But there are those vulnerable children who have to walk this journey and face life and all that is thrown at them. Somebody is asking, how and what is it within you that gave you the strength to keep facing every day?
I don't know. I truly don't know. I can't say that it was my own strength. I could try and put it to curiosity, but it was something more than that. I guess, and this is a guess, that, and I'm trying to remember, put myself back there, I just refused to believe that it was all going to come to this. How do I live a normal life and then one day I wake up and I'm paralyzed and that's it? I'm not even dead. It's not, MS is not a, what should I call it? It's not the illness that will kill you. Most people with MS live until normal, normal life expectancy. So how does it just end? So I would say maybe a bit of curiosity, but it was more than that. And by the time I was starting to realize, wait, this is something chronic, I was kind of, I'd gotten the hang of it, to put it mildly, that there are going to be good days, there are going to be bad days, and this is doable. So if I were going to give up after 5 years of having MS, then it definitely didn't make sense, because I had understood to some extent what happens with it. And then at some point, if I was going to give up when I was 25, then it was because, well, now there's such a good support system, what is my reason? And now, if I were going to give up, truly, I can't see why. I can't see why.
Great. Alice, when you look at your 3-year-old child, right now you speak with so much authority, so much strength, and you've had to deal with a lot. The question here is, you're a human being. Do you have down times? Do you have moments where you wish things were different?
Yes, I would say dealing with a child like Eliana, it calls a lot of strength. And it was not just like this from the beginning. At the beginning, it was much, much more difficult. Myself, as the mother, I couldn't accept. And I remember that on the day Dr. mentioned that Eliana could be having CCHS, I had not heard of such a diagnosis because basically even in the medical schools, it's not given much emphasis. And I had to go to the internet to try and check what is this congenital central hypoventration syndrome. And I couldn't read through it because it was scaring. Whatever information I was getting from the internet was very scaring to me. So it reached a point I couldn't even check from the internet. I don't want to see whatever I'm seeing from the information shared on the internet. Mm-hmm. And it was difficult. But at this point, I would say that with time, I've been getting stronger and stronger each day. Mm-hmm. And basically, I usually think if I'm weak and this is my child, she's in ICU, she's at a mechanical ventilator, mm-hmm. where will I, who will support this child? And through sharing with people, they usually encourage me. They tell me, Alice, you have to be strong for the sake of Eliana. Mm-hmm. You need this strength. But of course, there are those days whereby you feel very low. When I'm in public, you'll not know. Mm-hmm. But when you get into your house, mm-hmm. you're all alone, mm-hmm. and then you start imagining, I wish I was having my baby here. It could be much better. Mm-hmm. At times you cry mm-hmm. indoors. Mm-hmm. That is indoors, and then you wish, I wish it was a dream. I wish Eliana was okay. And then when you see kids who are her age mates, who are born at that time, you feel like, oh, my kid could be this age, she could be in baby class at now. And of course it affects you emotionally, you feel it, but you have to get some inner strength. Mm-hmm. And then you keep praying, because with prayers you get more stronger.
Yeah. Quite a journey. Now, some other statistics is that rare diseases impact more people than cancer and AIDS combined. Now, speaking of which, we have our reporter Bernard Ojwang all the way from Homa Bay, where there is a free cancer screening going on there. Bernard, if you can hear me, what exactly is going on and who is offering this service?
Hello? Nani yuko studio? Okay, thank you very much. We are live here at the Homa Bay Referral Hospital, whereby there is we have free medical treatment services that is free cancer scanning. Remember, it is a disease that has claimed many lives here in the country, both the poor and the rich, in rural and even in urban areas, and it is attributed to ignorance and even poverty. And remember, as you can see behind me here, many people have turned up in large numbers so as to get these free service. And we are also going to talk to some of the medic here to tell us what's going on and what's their intention. And without forgetting the beneficiaries, we are also going to talk to them and tell us maybe what are the challenges, maybe are they getting outside there in case that prevent them from not getting these kind of treatment. Currently, we are joined by the matron of this hospital just to tell us what's going on here today and what should people expect from this kind of program. Could you just tell us what's your name?
Thank you very much. I'm Mrs. Ruth Otieno. I'm the nursing officer in charge of this hospital. For the coming 2 days, we are going to embark on cancer screening. We are going to screen our clients with problems of cancer of the cervix, the breast, and we are also going to check the cancer of the prostate in the coming 2 days. So we expect people to come in large numbers. As you can see behind, People have started coming. They came starting very early in the morning. We still expect large numbers of people to come tomorrow. And even after the 2 days are over, we'll still continue doing the screening in the hospital as we have always done.
Madam Otieno, this is something that has affected which is affecting this country. What is this that preventing these people from accessing this kind of treatment?
Now, I think the cancer, you will not know that one you are suffering from cancer until it is very late. So this is making people to delay so much at home before seeking medical attention. But as they come, they will come because of they have seen signs of the disease. Otherwise, it is I may say it is knowledge deficit, it's ignorance, and not knowing that there is a need for them to be checked every year.
So today you've started it, and how many patients maybe are you targeting today?
We are targeting over 1,000 because it is capturing the entire county and the adjacent counties. So we expect even tomorrow to see like 1,000 clients. But today we expect to see not less than 500 clients visiting us.
Get us maybe the beneficiary. Oh, remember, it is something that has been affecting this country, and a lot of funds have been pumped so as to help the common mwananchi in rural areas. They are saying that they are targeting more than 1,000 people, and currently we are just going to be joined by Homa Bay County. Was going on here, and to tell us maybe with them what should they think should be done so as to save Homa Bay people from this kind of disease. Welcome. Tell us, I've seen you've joined these people in this kind of medical camp. Maybe what do you think should be done so as to prevent these people from this disease?
Thank you. First and foremost, what should be done and what has brought us here mainly is advocacy, encouraging people whenever they go for other treatments, reminding them that there is also screening, as was said by the hospital staff, screening for cancer of the breast, cancer of the cervix, and other cancers as they come for other treatments, because uh, the cancer develops in our bodies and advances to various stages without symptoms. In fact, by the time we start realizing the symptoms of cancer, it is normally advanced to second or third stage, which is more dangerous to our health, difficult to treat or reduce the symptoms. So we are mainly here to encourage people to ask for screening whenever they come for treatment of other diseases.
Okay, today it is being done here at the Homa Bay County Referral Hospital. We have other sub-county hospitals there in the rural areas. Maybe what do you think should be done so that the other people who have not come today so as to be able to access this kind of medical treatment?
Okay, today's meeting is just a beginning for screening for cancers within the county. But at the sub-counties, even our doctors, when they go for outreaches and other services, they do remind the clients they see that there is free cancer screening at the level 5 hospital here. So we are already encouraging people through advocacy to come for cancer screening, because early detection is the best way to deal with cancer. Yes.
Thank you very much, Madam Cyprian Awiti. Okay, remember that was First Lady Homa Bay County Governor, Homa Bay County First Lady Mrs. Cyprian Awiti, who has also joined the patient here. So as also remember, she has also attended. She has also been attended here, and she's now appealing to locals and even Homa Bay County residents to come for these checkups. And in case she's also advising the Homa Bay County people to make sure in case they go to any medical facility, they should ask for this kind of services so as to help them know their status. Back to your studio.
Bernard Ojwang speaking to us from Level 5 Referral Hospital in Homer Bay County, where there's free cancer screening going on, and this will go on for the next 2 days. And it's interesting that some of the statistics under rare diseases is that it impacts more people than cancer and AIDS combined. Now, Dr. Laura, somebody would sit back and say, no, that is not the case, but you know better.
Yeah, well, so that's all the rare diseases. However many they are, impacts more people than HIV and cancer put together, because each rare disease is represented in each country by a particular number of statistics. If you put those together, then it makes sense that it would be more than HIV and cancer, doesn't it? Because we're not looking at MS by itself, or CCHS by itself, or trisomies by themselves, or hypoplasias by themselves. It's all of them put together. Intuitively, if you put that many illnesses together, it would affect a number that is greater than HIV and cancer.
All right, now, Alice, you're a caregiver, you're part of Rare Disease Kenya. Having walked this talk, what are some of the things that you think people living around you, or just watching you walk this walk, should be sensitive about when they come to dealing with you and your child?
Okay, when you're dealing with a rare condition like me and my child, actually you become more sensitive, especially to people you're interacting with. Because some people will come asking questions that at times you may not even get an answer. Like, for example, I usually meet with people and they keep me asking, how is Eliana? And the response is, Eliana is good. When is she coming out of hospital? I don't have an answer as at now, but giving somebody such a response, it is difficult. So basically, I usually tell them soon, and I trust it's going to be soon. And then some of them will, you see, when you have a child, she has delayed milestones, and then some people will come, you see, Eliana angekuwa shule, such messages, you see, they trigger, they take you back somewhere, and you feel they affect you, they are affecting you directly. Again, they'll keep telling you, oh, and you have changed for the last 3 years. You are like this, you are like this. You used to come to maybe social places, because you see, when you have family meetings, you used to meet, maybe you have a friend's function and you fail to attend. Some people will not take it positively. They're like, oh, you missed my function. You refuse to come. Yeah, actually, that is the, people will tell you, oh, you refuse to come for the function. And then it's like, I feel like these people do not understand me. I feel like these people feel like, probably because you are working and they have never met you crying, or they have never found you maybe emotionally directly affected, they feel like, oh, she's just like any other person. She should have come for that function. At times it's not possible. Even going home just to see our parents have been difficult, because basically you weigh, do I go home and see them? Should I go visit Eliana? So you set your priorities, and most of the time our priority is to go and see Eliana. You cannot go to some of these places. So basically, it is good if you have maybe a relative or a friend who is dealing with a rare condition, either as a patient, a parent, a caregiver. It's good that the society sometimes, it's good to understand such people and give them the necessary support. So most of the time, we are much more than willing to come for those functions, but we can't. Because at the same time, you see, a child like Eliana needs a lot of, even our presence. Going there, we usually feed her. So most of the time, we are there like 3 times in a day. So even if I wanted to come for a function, maybe visiting you like I used to do previously, at times it's not possible. And through this, you find sometimes you are forced to isolate yourself from people, because maybe you are worried Sometimes I'm worried. I'm like, I don't want to go to a certain social gathering because I'm worried. What kind of questions will they ask me? What is the response that I'm going to give them? Well, some people may feel like probably you are avoiding them, or they feel like maybe you have changed. But it's good to understand. At times people in fact, even going to church has become an issue because in our place like Magadi, the population is so small, and you find that these people, they know you very well. Everybody is like, you go and then you're finding you get like, people are asking you many questions, you don't have an answer. Sometimes they even make you emotional.
Yeah.
So the only way you can deal with it is maybe avoiding, and you feel, I just want to stay in the house.
Okay, now, Dr. Laura, this insensitivity is not only for the laymen, even the doctors at times are caught up in that, because 70% of physicians say it would be helpful to receive additional training on rare diseases. Some of them have no idea what they're dealing with and might misdiagnose some things, like the delayed milestones, and attribute them to other things.
Yeah, and I'd like to add to something she said. I tend to look at people who are a bit different from me in whatever way. I look at it especially people with rare diseases, chronic illnesses, disabilities, that kind of thing. Number one, do unto others as you would have them do unto you. That thing you're doing with Eliana, would you have someone do that with you? That question you're asking her, would you like someone to ask that question if you are in her shoes? And the second thing is, must you ask yourself before you ask that question, or before you do that thing, must I? Must I ask her about this meeting now that she missed? Is it important? Is it a matter of life and death that she missed it? Because that way you are a bit more sensitive to what she is going through. Must I cause a lot of chaos about the things that she's able to do or not able to do? Number three is, if you are in doubt, ask. Always ask. People who have rare diseases and illnesses such as MS most times end up having disability. Like I said, I sometimes use a cane. There are people who reach out to me and they take the cane and it has a thing here. You see, it's adapted to my height. And so I'll leave it somewhere and someone will come and then they'll move it. And now next time I come, it's taller than me, shorter than me, I'm tipping forward. Or sometimes when I would be in a wheelchair and I have come out of the wheelchair for some reason and you find someone sitting in it, it is absolutely insensitive. This is an extension of that other person's limb. Would you take my hand and start playing with it while I'm sitting here? So if you are in doubt, ask, can I hold this thing? Can I look at it? Can I move it? Can I sit in it? Maybe if there's a reason you need to sit in a wheelchair. And also for people who have the illness, sometimes we also need to be a bit sensitive. When someone is asking you, Laura, what's wrong with your feet? I wear heels along with my cane for reasons we shall not disclose today. But if someone asks me, why are you wearing heels? Sometimes they're not being belligerent. They really are curious. You have a funny gait, you have a cane, it doesn't make sense that you're also in heels. And I will take time to explain, but that needs some maturity. And now for us doctors, and again, I apologize deeply, deeply, that sometimes we are a bit insensitive. I shall not go into reasons why we might be, but sometimes we are. And as that person has said, maybe sometimes we don't know. And even beyond not knowing, we are first and foremost human beings. First and foremost, I am a human being before I am Dr. Laura. So do not castigate all doctors because of the mistakes that I have made as a person. If I am ignorant and I'm treating Alice or Kristen or any other person in rare disease, Kenya, or any illness, if I'm treating them horribly, I'm probably treating them horribly first and foremost because I'm a horrible person, not because of the title that comes with me.
Or maybe out of ignorance?
Or maybe out of ignorance. And it's something that we are working on, obviously, in all the whole conversation we've had today about research, about training, about other things. We are working on it. But while we are working on it, just treat us as individuals. Yeah.
Okay, great conversation here, a lot of enlightenment for you, Alice, as you go into the Rare Disease Day that's coming up on the 24th, and of course leaving this journey. What will be your message to mothers that have to endure caring for a child living with a rare disease?
Okay, my main message will be, you are not alone. If you have a child or a patient with a rare condition, you are not alone. So you need to reach out. with other people who are battling rare diseases so that you can connect and get more information. Stop, you find some parents, when you get a child with a rare condition, some of them run away, even leaving their children at hospital. Do not run away. It's not a curse, it's not witchcraft. You need to seek medical attention. So the best thing is you have to start strong. They have to start strong for the sake of these patients. And you reach out to the Rare Disease Group at Rare Disease Kenya in Twitter. You can also come to Facebook, Rare Disease Kenya. Reach to us. You'll get people who have gone through even more than probably what you think is too bad or it's too much for you. You'll find people who are going to encourage you. You'll find people who are going to probably make your life maybe a bit better through sharing. Do not keep quiet. Keeping quiet and maybe you avoid sharing and you are like suffering from the inside. It's a bit hectic. That's why you find people maybe committing suicide because you feel this is too much, I cannot share, there is nobody who can understand me. There are people who understands you and you can find them in Rare Disease Kenya. And therefore, I would like to welcome all to come to our Rare Disease Day on 24th at Gate Road Children's Hospital.
The one in Nairobi West or Muthaiga?
Yes, Muthaiga.
Muthaiga.
Yeah.
Okay, Dr. Laura, your case is unique. You are living with a rare disease and you're also a doctor. So your words?
I would say my message would be in two parts. To people living with the rare disease, don't let it do you in. There are people who are actively working to make sure that your experience is better. It might not be cured, but you should have more life in your days. You shouldn't be counting the days when you're dying. And to my colleagues and people who are involved in research in any capacity, let's do better. Let's do better. Let's fight to help patients living with rare diseases and any other illnesses. Let's just do better. Yeah.
All right. Thank you so much, ladies, for joining us. Dr. Laura Musambai, founder of Multiple Sclerosis Kenya, and also living with a rare disease. And of course, Alice Kamania, she's a nurse, part of Rare Disease Kenya, and also giving care to a child living with a rare disease. Thank you for your time. Remember